morning, good afternoon, good evening, wherever you are around the world. Welcome to Endometriosis Awareness Month. Dr. Matthew Leonardi and myself, George Condis, are incredibly excited to be part of this Q&A session that ISUOG has put together. And we've got some really hot topic questions that have been put to us by patients, and we're going to go through those today. So firstly, I'm going to hand over to you, Matthew. So what's our first question?
Our first question is, why does endometriosis happen? This is a brilliant question, and a question without an easy, simple answer, unfortunately, despite everybody's hope that it's a simple answer. The reason endometriosis happens is definitely multifactorial. That means that there's lots of things that go into the initiation and the development of the disease. To be relatively simple about it, there are some mainstay reasons, and these are genetics, immunity, inflammation, and irregularities in menstruation. This is the main box of reasons why pelvic endometriosis exists. And of course, there are unique extrapelvic types of endometriosis that may not be explained by the same reasons in that box. But those are the main reasons in the pelvic endometriosis box. George, would you tell us a little bit about the hereditary nature of endometriosis?
Yes, of course, Matthew. There's no doubt that, as Matthew has said, that a person's genetics is probably one of the reasons that a person who's assigned female at birth may have a tendency to develop endometriosis. And as Matthew said, there's other environmental factors that can also contribute to this. I don't think it's necessarily a hereditary disease or condition. However, there's been work looking at twins, particularly identical twins. And in those twins where one of the twins has endometriosis, there's a much higher chance of the other twin having endometriosis. And this is much higher than in non-identical twins. So our advice to those listening today is that if you have a first-degree relative, such as your mother or your sister has had endometriosis, and you have symptoms that you think may be considered or associated with an underlying diagnosis of endometriosis, then it's really important that you see your general practitioner or gynecologist so that you can get input to help you to confirm or exclude the disease.